All right, let us discuss skeletal muscles. So, skeletal muscles are the most responsive muscle tissue, and this is partially because they are the only voluntary muscle tissue. The reason it is voluntary is because we can actively control it. I can decide to do a bicep curl, to do a squat, to stand up, sit down, walk, whatever the case may be, whatever action it is. If I'm looking at the other muscle types, I cannot control that. I cannot choose to contract my heart. It is going to do it automatically. And that is one of the big differences between skeletal muscle and the other two muscle types. Skeletal is the only one that is voluntary. Skeletal muscle is going to be dominated by that muscle tissue. However, we are going to find other tissues involved with them. Some of them should hopefully be self-explanatory, like nervous tissue. You need nerves in order to contract. Other tissues involved are going to be your vascular setup, so capillaries, arteries, and veins. We're going to have various connective tissues also involved here with various membranes. And we're actually going to start with that outermost membrane. The entire muscle, skeletal muscle, so again, I'm going to pick on the biceps muscle here. The entire biceps muscle is surrounded by a dense, irregular connective tissue layer known as epimysium. Now remember, myoso, or mycio, is muscle, is structure, epi is above. So epimysium literally translates to structure above muscle, and that's exactly what it is. The epimysium is a membrane that completely surrounds the entire muscle and extends into the tendon at each end. Inside that epimysium are going to be several bundles of muscle fibers. Each bundle is known as a fascicle. The fibers that are inside are super long. They're going to run the length of the muscle, and they are each going to be individual cells. Each fascicle is going to be surrounded by another layer of dense, irregular connective tissue that is going to be called the perimysium. Remember, peri refers to around. So these are membranes that surround the fascicles individually. So we have an overarching membrane, and then we have a membrane around each individual bundle. Then moving inside the fascicle to each cell, these individual muscle fibers are going to be surrounded by a fine layer of loose connective tissue. This membrane is referred to as the endomysium. So we have an overall layer membrane. We have a membrane clumping them into bundles, and then we have a membrane that's around each individual fiber. All of these membranes are going to run into each other, and all of these membranes are going to run into the tendon at each end. Now, remember, if you've butchered an animal before, or if you've taken like a whole beef tenderloin or a rack of ribs and you've cleaned it up yourself, as you're pulling apart fibers, you have this like stringy membrane, and then you have like that silver skin. That's all of those membranes. These membranes, especially the epimysium membrane, don't really break down. This isn't fat. This is just connective tissue. Now, this fine layer of loose connective tissue, it is very fine. It's that spiderwebby type as you're pulling these muscle fibers apart. And they are going to be, you're not going to notice them. It's this epimysium that you really do notice. So each skeletal muscle is going to be supplied by one nerve, an artery, and then one or more veins. They're all going to enter and exit via the connective tissue coverings and will branch extensively once they get through that outermost membrane. All right, now As we mentioned, skeletal muscles typically are going to span joints and they are going to attach to bones. Now, depending upon the attachment and the way the joint and bones are going to move will depend on what we actually refer to that attachment point. So every muscle is going to have an origin attachment and an insertion attachment. How do you tell which is which? You need to know the mechanism of action or movement. So how is this muscle going to be moving bones or joints? Again, look at your bicep. We are going to be moving the forearm. So the bicep attaches up on the scapula and then attaches down on the radius and ulna. The attachment site that is attached to a bone that isn't moving in this movement pattern is referred to as the origin of attachment or origin of joint. So for my biceps, that's going to be the attachment on the scapula. The scapula is not moving when I do a bicep curl. The second attachment is called the insertion attachment, and that is the attachment to the bones that are moving when you contract the muscle. So for my bicep, the origin is the attachment on the scapula because it's not moving. The attachment on the radius and ulna, those are moving, so that is the insertion. Now, that one's a pretty simple one. There are some muscles, for instance, the quadriceps muscle, which are actually a whole bunch of different muscles, but the attachments, whether or not it's an origin or insertion attachment, varies depending upon what joint we are moving. There are some muscles that span multiple moving joints, and they're involved in the motion of both of those joints. What do I mean? Take a look at your leg. Now, in theory, you're probably sitting right now. The quadriceps muscle extends through the patella. The patella is actually embedded in that tendon and attaches to the tibia on your shin. It also comes up and attaches all throughout your pelvic bones. Now, what can I do with my quadriceps muscle? I can extend my shin out, straightening my leg, and I can bend it. That is one joint of movement. However, the quadriceps is also involved in flexing your hips. So if I go to stand up, I am extending my hips, straightening them. That's going to also involve the quadriceps. And the origin and insertions are going to be different for both of those joint movements. Now you might be wondering, okay, but the biceps crosses the shoulder joint. I can move my shoulder joint in all different ranges of motion. Why does the biceps not do that? And that's because the biceps is not involved in extending my entire arm. It's not involved in extending it backwards or forwards or to the side or in front of my body or doing arm circles. Those are all of those other rotator cuff muscles. They're responsible for those motions. So we're not going to really test on that. I'm not going to ask you, if I am flexing at the hip, the origin insertion of the quadriceps would be what? But if I'm flexing my knee, what would the origin and insertion of the quadriceps be? I'm not going to ask that question.